So I wanted to talk a little bit about imaging, because this is really important to understand. Just because you have imaging findings does not mean that we can't improve the symptoms that you have. So the imaging findings likely will not change with movement. Like if you have degenerative disc disease, which by the way, it's not a disease, it's normal, but if you have that, then that's not going to improve in terms of like the imaging finding. If you have stenosis or a disc bulge or scoliosis, like none of that on the image is going to necessarily improve. But I can't tell you how many dozens and dozens and dozens of people that I have worked with who have these findings on imaging, and with the right framework and the right movements and understanding what's going on and how to address it, fixing, or not even fixing, but addressing like beliefs that might be unhelpful. Like once you do that, the improvement is pretty dramatic. Now some people need additional services, whether it's medication or an injection or a surgical procedure, but those are the very small percentage of people. And by the way, if like you are that person, it's not a failure. Like it's not a failure to need some medication. It's not a failure to need an injection or some surgical procedure or something. It's a failure to not truly understand your pain, to not find movement that works for you, to not engage in your life. Like that's a failure, right? And engaging in life can mean a lot of different things. So we'll figure out what is most important to you, and we'll make sure that we're putting that at the very forefront of what we're trying to accomplish together. So again, the imaging, while it can be helpful, it doesn't necessarily tell us how much pain you're having. Actually, it doesn't tell us how much pain you're having whatsoever. I have plenty of people who have lots of imaging findings and minimal pain, and then some who have no imaging findings and lots of pain. So it's only one data point, okay? Only one data point. We're gonna go based on what your symptoms are and try to improve them from there, okay? So that's the main thing for this video, and that pertains to MRIs, X-rays, CT scans, any of that diagnostic imaging.